We have started 2 or 3. So if you mind that we record, please mention it in a private message or a chat, because we indeed want to record it if nobody objects. So 2 or 3 years ago, we started this learning circle series as a group of social innovators who all believe that agency in a community is key to grow and self-develop as a community and grow your own well-being. So community-based organizations, community change makers, microfinance institutions, all agents of change in communities that really take their community forward, self-develop with the community. That's actually the group of peers that we assemble. And we said yes to, let's learn from each other, because each one of us is in a different reality, brings in different local wisdom, brings in different solutions. Let's learn from each other. So that's how this learning circle series started a few years ago. And today we are super happy to have with us Betteke and Deepak, both co-founders, if I can call you like that, of Karuna Nepal, starting almost 2 decades ago, 15 years ago, on a mission to save children from disability. And their journey, their learning journey, was through developing a disability inclusive society. And they did it all themselves from scratch. And one of the core what's the ticking heart of the solutions that they created with the community is, I think, the share and care model that started a few years after they set out on this with this challenge. How do we create a disability inclusive community by community? And this could be described as a community-led insurance model, but it's way more than that. And actually, that model also later on developed in something that they call Inspire to Care. And you can imagine that they learned a lot doing this, developing this, co-creating this solution with the communities. So we are very happy today that they are here to openly share what they have learned in their journey with you, and they are very open to also take question and answers from all of you who are community-based innovators, entrepreneurs, doing the best for your communities. So that's what we're going to do today. A few practicalities. We probably take around 15 to 20 minutes to really listen deeply to their stories. I will only ask 2 or 3 questions to get the story from beginning to end and get to the tips and tricks that they can share. After which we still have more than enough time, at least 20 minutes, to also answer some of your questions. So please bring your questions. If they pop up in your mind, but they are still speaking, please use the chat. We will make sure that we will also ask those questions to the speakers today. Like I said, if you mind, please let us know, but otherwise we will record the session because we would like to take stock of some of the learnings and share it with a larger audience. Um, to also make sure that everybody knows. Can you, by the way, all please mute, because I can hear myself if you're not speaking. So to make sure that everybody knows a little bit who's in the call, but without losing too much time, we like to say in the chat, if we would like to invite you to tell in the chat your name, which organization you're part of, and where you're based or where you're operating. So then all of us know who's in the room. Okay, with that, I hope I didn't forget to many things. I'm very grateful that I can introduce you to Betteke and Deepak, who will take parts of the story forward. Like I said, they are both co-founders of Karuna Nepal. Let's start with the question, how did this all came into being, and how come
Rabia
a
number set.
point that you developed the share and care model in Nepal. Maybe Deepak, you can take us away a bit about sharing the beginnings and the developments into the share and care model.
Yeah, thank you, Erlene, for this nice introduction. Hi, everybody. I think we are from different time zones, so I do not know where is morning, where is afternoon, where is evening. So namaste and greetings from Nepal. My name is Deepak Raj Sapkota. I'm in Karuna Foundation since last almost 17 years. Erlene, when you say 2 decades, I felt, I'm getting very old. So time is really an issue. Uh, in 2007, BTK, me and another gentleman from Netherlands, we met and we decided to set up an organization called Karuna Foundation. And our aim was to prevent childhood disability and also provide better quality life to the persons with disability. There are in any country or in any society who is responsible for those issues. Organizations like Karuna Nepal, somebody else from somewhere else, who is responsible. And our ultimate conclusion was, if there are any issues and problems in any society or community, the first responsible person or community or the first responsible unit is the person who is having a problem himself or herself, and then the family, community, and ultimately government. So from that positioning, we decided that, we will be providing our knowledge and resources if there is a need, if there is a demand. Need is maybe a little bit wide. We believe that we can. So if there are initiations from the group of people or individuals who are having issues in relation to prevention of child disability and disability and approach us, then we work together with them to come to a point. That is how we started. But that saying it is very simple, but making it happen was not that easy. And we were aiming to develop a model that can benefit many other communities as well. So we decided not to approach individual person, but we decided to approach a municipality. By then, in 2007, it were village development. We started to, whether you like it or not. If you like, what is your proposal? How seriously you are considering this issue, and then how you would like to bring it to the next level. And many things happens. We piloted this program in many.
Deepak,
yes.
1 second, you're breaking up quite heavily. Is there a way to get closer to the mic, or maybe stop the cam? I'm not sure. Is there anything you can do?
Like maybe internet problem, I guess. Yeah.
Let me change my connection. Is it better now?
It seems
it's better now.
Yeah.
It seems better.
Okay. Okay. So from that point, we started Share&Care in a couple of villages of Nepal in 2007. But as our vision was to cover larger population, as people with disabilities, if you see in percentage, it's 2.2 kind of percent, and pregnant mothers and newly born babies also something like the similar number in general. So covering 4% people through your program does not create a holistic or larger collaboration. So we introduced community-based health insurance in Nepal to strengthen our program, and it was pretty successful. And based on that experiences, also government of Nepal decided to get to the next level of introducing health insurance in Nepal, piloting in 3 districts, and now it has become nationwide program. There are lots of ups and downs of this program, but that was one of the moment, a very decisive moment where government decided to take health insurance as one of its priority agenda. And as an organization, we decided to continue with our focus, prevention and rehabilitation. And every time, whatever we did, our philosophy was, are people ready? Do they really appreciate what we are offering? Or we are creating more dependency by going to a community without idea and resources and starting a project. So that led us in 2000, already, in 2010 to collaborate with municipalities, not only in terms of implementing program, but also sharing the cost. So in 2017, to summarize, we came to in a stage where we convinced one of the provincial government of Nepal called Kosi, which is eastern part of Nepal out of 7 provinces, to introduce a prevention and rehabilitation policy with specific objectives like cost sharing. The provincial government committed that they will put 1/3 of the program cost. The municipalities Would you please mute your mic? One of the participants, please.
I think it's the happiness. Yeah, yes. Thank you.
And the municipalities put 1/3, and Karuna, as an external partner, invest 1/3 of the total cost for first 2 years. And the model is pretty functioning. We have exited from 73 municipalities out of 137 municipalities of Kosi province since last 2 fiscal years, and provincial government and municipal governments are allocating money and taking it to the next level. And recently, the Federal Ministry of Government of Nepal, who is responsible on disability, called Women, Children, and Senior Citizens, decided to join the effort to scale it up in different provinces of Nepal, and this is happening. So we are part of this whole initiation, and then this model also is somehow is replicated in Congo, DRC. Kenya and Tanzania also are in the process of implementing similar model, and we all know context of these countries are different, so it's very context based. But the philosophy is people should take their responsibility. By the end of the day, government is responsible for dealing with the issues of their problem. And second thing that we are dealing very strongly in our life is exit. We very much believe that we cannot take and we should not take responsibility forever. And there has to be a very strong exit policy. So after completion of 3rd year, we exit from program areas, whether it succeed or fail. And we know, even though we are putting only 1/3 of finances of the program, many municipalities and government authorities see us as a partner, and then many times the program, which is called disability prevention and rehabilitation, is called Karuna's program. I can understand that from where it comes, but our whole effort is to make from the very beginning that this is the program of government of Nepal and communities, not of Karuna, which is slowly happening. But again, there is a dependency. The mindset is very strong that whenever there is external partner, they take it as an external partners program, and we are breaking it. And before we agree on collaborating with municipalities, we agree to set up a system within municipalities to implement whatever we have agreed. So before the system strengthening part is also a very strong component of the program from the very beginning. And the whole ultimate ambition, our goal is of making system strengthening is whatever you develop has to be implemented by the concerned authorities in a proper manner. So this is in nutshell what we have been doing, and then we are pretty happy that governments are taking responsibilities. People also are being responsible, and then many times wherever you go in different geographies, there are resources available. When I say resources, it is not only the financial resources, but also human resources, technology, knowledge, and many other opportunities exist. So the program is based on all those kind of foundations. Um,
Deepak, can I
yes,
ask can I ask you something? Because I think we all recognize what you're saying about responsibilities, and it's massive, your approach in the communities and also including the governmental parts and the village committees from the start. What would be your golden tip or suggestion? I know you speak a lot about collectivity makes the biggest difference, right? So you really, so how do you incubate that kind of agency to create a collective out of a village or a community when you come in with an idea and with a mission, and I'm very happy to see many of communities joining this call, so they might also want to answer that question. But how do you create that collectivity, yeah, and who is driving that process in the communities? You're muted.
this was my next point to talk, Arlene. Thank you for bringing me there. Normally in Karuna again, we see development is a political and policy issues. So what we say, in each municipalities, for example, there are elected mayors and bureaucrats. So we sit together with these elected representatives and explain why this is important for them. And once you convince them, or once they understand the value of the program, luckily disability is a neutral issue, and many, across political parties, there is a wider acceptance in general to move forward. So once you sit together with these leaders of municipalities, and once they agree to move further, then it's way easier to champion on the issue. Then you bring people with disabilities, and there are organizations of people with disabilities and many other kind of community-based organizations that collaborates together, and then it becomes the part of the municipality as a regular intervention to deal with the issue.
Arline, there is another question in the chat, which is, are you using appreciative planning and action process developed in Nepal for mobilizing communities to participate?
Thanks, Sid.
Well, yes, but to be very honest, to be very honest, I do not like to make the program, with lots of jargons and, to make the programs more effective. All this positivity is very necessary. There has to be a lot of appreciation what has been achieved so far. But one of the biggest problem of my country so far, I feel, is, we have best laws and policies and plannings, and the poorest part is the implementation. And it happens because of three reasons in terms of disability. One, it's less priority in a way. It's only 2.24% kind of population, and they cannot raise their own voice and go to the authorities and demand. Number two, there is a lot of tokenism. For example, I was going through the budget of Nepalese government for the coming fiscal year, and the program is distributed like nothing. And then the resources is complete, in a way, misuse of resource by giving little bit money to everyone to make them happy. So from all those kind of view, appreciative planning and action process is very much we follow. But what we do is, we bring the politicians, policymaker, bureaucrats, and beneficiaries together in one room, and we make plan together. So, well, I do not know whether it fits within that definition or not. And then in every 3 months, we review how things are progressing as per the plan. Despite of these efforts, we have been able to spend almost 90% of the total money that has been allocated. So, it's pretty tricky. And maybe Beteke, if you would like to say something on that part, would be appreciated.
Yes, so good afternoon to all of you. Yeah, thank you, Elaine, for giving us the opportunity to share some experiences. I already see that somebody has a question. Let me first very briefly add to what Deepak is saying, and I always use other words because I'm from a different context. But how I see it is that what we have been trying is to strengthen the existing systems. So not creating something parallel, but to strengthen the local government systems. And to embed each and every intervention in the local structures, in the local government, in the community structures, in the self-help groups, etc. And why? Because we very much believe that but the exit, that we really would like the activities to continue, and in this case, that children with disability and their families will be part forever until the next generations. So then it should be in the local structures. If not, when the money ends, when the external aid has come to an end, then everything falls down. So that is what we really believe in, that communities, that we should use all the local resources so that communities are not dependent on external aid. Let's say we from West, I'm from the Netherlands, same country as Erlijn. We from the West, we are not the ones who, we do not belong to your country, to your policy. So the only thing we can do is give a push, temporary push with resources, and if necessary also with knowledge and network. That is our perspective, and what Karuna has been doing for the last let's say 17 years in Nepal. We are trying to replicate that in Congo, a very difficult context. And why are there some success factors? That is because the principles are the same. So strengthening communities, embedding all the activities in the local structures, seeing where in the policy and the law, where what is the entry point? What is the entry point? Because it's all about, let's say, the national and provincial and local laws and policies. So because if you, that is where where the needs meet the rights. That is how we should see it. And making ourselves, especially we from the West, we should make ourselves redundant as soon as possible. So this is what I would like to say. So maybe Acute, you would like to ask question?
Hi, thank you, Deepakji, for your presentation. So I'm also from Nepal. Basically, I'm associated with Great Himalayan Trail Program, although I'm associated with other program as well. So I know a little bit about Karuna Foundation, and then one thing is what I want to know more about it. What is the process? For example, if you say the community-led incidence program, so how does that work? How an individual can benefit from this, and what are the critical role that you are expecting from the municipality? Are you thinking that the system will be embedded in the municipality itself, and then you leave? Or you will have some role even after you embedded that program into the municipality. I think this is something I want to know, because in Solukhumbu, where we have started this Great Himalayan Trail program, also we are planning to work closely with the municipality. Your experience might help us as well. Thank you.
Yeah, thank you for the concern, Achyutji. I think as you are here in Kathmandu, we can meet and I can explain you
I'm thinking of meeting you as well. Yeah.
Yeah, so let's do that. And in the meantime, I think the insurance is now, as you must know that like it's now taken care by Ministry of Health. There is a separate insurance board, and the whole things are developing. But in terms of attracting and making municipalities responsible, so far we have learned is not that tough task, because political leaders are very interested to see development. there are lots of discussions going on with, these political people are corrupt, this and that. There must be something going on. That's not my business. But, whenever we approach our mayor or mayors of municipalities with a very concrete modality, that has helped significantly. And there is no rejection so far, I feel, in our case. And I think that must be a little bit triggered by a feeling of solidarity. That is, there is a provincial government taking responsibility, sharing the cost. There is a development partner like Karuna is joining hands to make it happen. And then, they believe that, if we work together, if the resource and knowledge is coming together from, higher authorities as well as development partners, the feeling of solidarity and, having confidence to deal with the issue is very key part in this case. So we were lucky enough, we're very, in a way, maybe it's a little bit arrogant to say, but we're strategic to convince provincial government to develop the guideline where they very clearly say what is the role of each different parts. And that gave a lot of assurance to the municipalities to move ahead. And disability was one of their issues they really wanted to do, but less money, no idea, and no clear vision. So they were lost, which I think gave us a big space to go to the next level.
Okay, thank you. Then we can separately talk about this appreciative planning and action. I think this is quite important thing that you can also adopt. I think everybody can adopt that process in order to make sure that the stakeholder participate in the kind of program that we are planning to introduce.
This is always the very exciting part, I think, of those learning circles, that you actually see that linkage and connection immediately arise, and you are encouraged to connect offline too. And
Thank you.
so
Thank
very
you.
nice to see this happening. Maybe before we will open up for more questions from the audience, I know there's also a very exciting part where you moved from the Share&Care program a bit more into the Inspire to Care program. And there was a real reason for you to do so. And there's some differences in the programming. So maybe you could share a little bit of light on why you did this and how the programming changed a little bit, especially also from the perspective of the communities. Either Deepak or Batika, I'm not sure who feels best positioned to share something on that transition.
So Batika, maybe.
But my microphone is not very good. I tend to know. So maybe Deepak, it's good if you talk about this.
Okay, then thank you, Batika. Then to Achuji, I think we also are operating in Solukhumbu, all municipalities of Solukhumbu. So, I think there is a need to sit together as soon as possible and see, what can bring this collaboration to both of us.
Yeah, sure.
I think when we started Share&Care in 2007, our idea, we were very focused on prevention and rehabilitation, but we realized that to achieve the goal that we have set, we need to have a better healthcare system and community solidarity in the municipalities. To make that happen and to cover the larger audience than 4 or 5% of the total population, we introduced community-based health insurance in those villages. And that really, the program was pretty successful. We were able to enroll 80% and also not only enroll, to continue to the next coming years. So that was very rewarding experience for us. But in the meantime, government of Nepal decided to take health insurance in a very specific manner, and we supported that process. We were also part of the national policy development, and once it was done, we decided to come out from health insurance because it was not our cup of tea. It was not our priority. Our priority was prevention and rehabilitation. So we more focused to champion on these two issues. And ultimately, what happened is, getting more focused and, trying to see problems from every aspect gave us wider recognition and also, a kind of confidence within the team of Karuna that we were able to reach to the provincial government and say, hey, this is, you have committed in constitutions you have ratified CRPD, you have made all the laws and policies and programs to deal with disabilities. Here is a solution. Let's work together to deal with these common issues. And that was a very interesting moment where the provincial government agreed to go to the next level. And that's how we came to Inspire to Care. And then finally, when we were settling, deciding on the name and every activities, the government says Inspire to Care is pretty abstract. It could be anything. And then we decided to be more focused in terms of naming. This is how government operates. So we decided to again move to Disability Prevention and the Rehabilitation Program, which is called DPRP in short. But the fundament is the same from Inspire to Share and Care to Inspire to Care to DPRP.
Oh, okay. That's fascinating that you also adapt the terminology, but still you're always present there in the community. So let's wrap up the sharing part and open up for some questions and answering. Maybe explicit invite to the community groups, because we talk about community participation, but there's communities here in the call too. So maybe to Deepak and Betteke, it would be nice to hear if you have a tip. Where can you start to make the communities inclusive of handicapped people and start working on that topic as a community? Where would you start? But of course, the community groups, and I'm not sure if I pronounced the names correctly, but in Napam and Kirot, or that's maybe the host, feel free if you have a question like how can we bring this inclusive approach of people living with disabilities from Nepal to our communities, and you're all based in India, that is what I know. Please feel free to speak up and ask the question. Now's the chance with Deepak and Betteke on the call. But till that time, till you speak up, Deepak or Betteke, do you have a suggestion where you can start as a community if you want to include more people and start doing a round in your community?
The approach is to start with, let's say, strengthening the system. So making the municipality or the local government is responsible, and community people also, of course. But so if the question is from the perspective of the community, then I would say it starts with identifying all the persons with a disability in your community. And always the community knows best where they are and who they are and what are their needs. So it starts with identification and bringing them into the mainstream. So making sure they have access to healthcare, to rehabilitation, to education. And if that can be done, which is already a huge task, then something which from our experience is really important is to have, let's say, positive visible results in the lives of children with disability and their families, so that everybody sees that they can also contribute to society, and that progress is possible, and that changes are possible. That gives so much hope that there will be more buy-in from local government, more buy-in from community, more buy-in from parents, more support. So at one side, creating examples of children with visible results, and at the other hand, making local governments accountable. But maybe Deepak, you would like to add something here.
No, I would like to add. I agree with Betteke. 2 quick points. If you really would like to develop a model that with the expectation of scaling to the higher level, then there has to be, you need to create a political and policy consensus. I think that is the beginning. So far, I feel, in every community, in every village, there are a couple of leaders who can influence the whole process. So this is one part. The other part, if you are not trying to develop a model that can be scaled, but if you try to do something in a very specific manner in a community without much expectation, then you can take responsibility. And then you can start with counting the people, making a plan of individual interventions, blah, 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 blah. But our idea from the very beginning was, like we can create a model, a pilot by our own effort, but we really wanted to make it sustained, and sustainable, and then, go to the next level. So we decided to collaborate with government, and we also decided to convince the policymakers and politicians to make it happen.
Can I say something,
I think
Airline?
it's very exciting to hear a very practical, like start going out.
Can I say something, Airline? I just want to add what Deepakji has said, in terms
Yes,
of community
of course.
mobilization. The thing is, what he mentioned, that yes, there are kind of leaders in every community, but if we just trust on them, sometimes they may misguide the community. That's why our approach that we are trying to adopt, that is what we call as appreciative planning and action approach, that really help community to empower from the very beginning, so that even the bad leaders cannot bring them in a wrong track. That is why we should not, having worked in the community for the last 35 years in different countries, what I believe that you have to use a kind of process with the community so that you can really dig out the real solution for the problem that they are facing.
Yeah, thanks, Ashut. It's clear, but still, I think we have very empowered community leaders on the call now. It's really nice to have a starting point for them to start. I see another hand raised by Swapna. So Swapna, would you like to?
Yes, thank you so much. Namaste to the whole Karuna Foundation team, and I just wanted to bring up one thing. I'm from Drishti, India, and here we have actually a lot of community leadership groups who have joined in from different villages in Assam and also from Darjeeling. So Darjeeling community group can also speak Nepali, but Assam community groups can only understand Hindi or Assamese. So it would be really good if Deepakji, you can just give a little bit of maybe tips to them, because when they heard that there is something like a community initiative for health insurance, that is the interest with which all of them have joined in today. So would you like to use some bit of Hindi or Nepalese to address their basically, like they had this idea that how they can start, or what can be the core idea behind. You just mentioned few things in English, but I just thought if you can interact with them. They are mainly working, this is a leadership group which actually leads women-based livelihood initiative called as Swavalamban in different parts of India.
Thank you, Swapnaji, for asking in Nepali. Maybe our program is very next to Darjeeling. We are very close to this Nepal-India border in the eastern part of Nepal. So it's way better to get them in Kakarpita, the next city to the Indian border of Nepal. It's one day they can come in the morning and maybe go back in the afternoon. But anyway, so सबैजनालाई नमस्ते. हामीले यो काम सुरु गर्दाखेरि समस्या सबैलाई एकैपल्ट पर्दैन हैन. समस्या चाहिँ थोरैलाई एकपल्ट पर्छ अनि फेरि अर्कोलाई अर्कोपल्ट पर्छ अनि अर्कोपल्ट पर्छ, तर समस्या हामी सबैलाई कहिले न कहिले पर्छ. त्यसैले कुनै न कुनै बेला पर्ने समस्याको लागि हामी सुरुदेखि नै मिलेर तयार भएर काम गर्यौं भने हामी सबैको रिसोर्सले, हामी सबैको बुद्धिले, हामी सबैको बलले जसलाई समस्या पर्छ उसलाई हेल्प गर्न सकिन्छ. अनि हामीलाई समस्या परेन, उदाहरणको लागि स्वास्थ्य बीमाको कुरा गर्दा मैले 1000 आइसी तिरेर बीमाको सदस्य बने, तर मलाई यो वर्ष कुनै रोग लागेन भने हामी दुईटा काम गर्न सक्छौँ। एउटा चाहिँ ओ मेरो 1000 रुपियाँ गयो, मैले त्यो 1000ले अरू के गर्न सक्थेँ भनेर दुःख मान्ने। अर्को चाहिँ मेरो 1000ले मेरो समुदायको अर्को साथीलाई एकदम मद्दत गर्यो र थ्याङ्क्स गड, धन्यवाद भगवान् कि म बिरामी भइनँ। बिरामी नहुनु त सबभन्दा ठुलो कुरो हो नि, होइन? बिरामी हुनुभन्दा सो बरु 1000 रुपियाँ हरेक वर्ष तिर्छु, बिरामी हुन्न भन्न पर्ने यो कन्सेप्ट, सोलिडारिटीको कन्सेप्ट, आपसी सहयोगको कन्सेप्ट र मिलेर गर्दा गर्न सकिन्छ भन्ने कन्सेप्टमा बेस भएर गरे हो। तपाईँहरूलाई स्पेसल्ली दार्जिलिङ र आसाम इज नट फार फ्रम त्यो हाम्रो प्रोग्राम एरियाबाट। झापा जिल्लामा पनि हामी काम गरिरहेछौँ, इलाममा पनि काम गरिरहेछौँ। हजुरहरू कसैलाई पनि त्यसको बारेमा सिक्न मन छ भने हामीसँग सम्पर्क गरेर हामीले जानेको कुरा यहाँहरूलाई बताउँछौँ र यहाँहरूको अनुभवबाट हामी पनि सिक्छौँ।
नमस्ते सर,
नमस्ते हजुर।
म वाङसिङ भुटिया, म दृष्टिको एउटा इम्प्लोइ हो। अनि मेरोसँग अहिले दार्जिलिङको सबलम समिति मेम्बर जस्तै कि सतीक्षा तामाङ होइन, अनि पेमला तामाङ, अनि यता के रिना तामाङ मेम्बरहरू हुनुहुन्छ। सो हामीहरूले सबलम समितिको हामीले दार्जिलिङमा स्टार्ट गरेको 2000 तपाईँको 23बाट स्टार्ट गरेको थियो। हामीले अहिले के गरेको छौँ भने हामीहरूले मोस्ट प्रोबेबली तपाईँको वुमेन एम्पावरमेन्टमा हामीले काम गर्दैछौँ। सो अहिले अब तपाईँको यो कैन्जीले जुन चाहिँ भाटिकामा छ, अब जुन चाहिँ दार्जिलिङको लाइक हिली एरियामा हो, जहाँ चाहिँ वेदर कन्डिसन पुरा लाइक मोस्ट प्रोबेबली लाइक 12 महिनै तपाईँको चिसो जग्गा हो। तर उहाँहरूको लागि हामीले के चिजहरू हामीले लाइक सहुलियतहरू दिन सक्छौँ, कसरी लाइक उनीहरूको जुन चाहिँ अलैँची भयो, अदुवाहरू भयो, त्यसलाई डिहाइड्रेट गरेर त्यसलाई पाउडरहरू बनाउने, त्यस्तोमा हामीले ट्रेनिङहरू दिएर उनीहरूलाई एम्पावरमेन्ट गर्दैछौँ। हेलो, सो त्यही हो, तपाईँहरूलाई इन्ट्रोडक्सन चाहिँ मैले गराइदिएको हिल्सको भएर, दार्जिलिङबाट चाहिँ।
धन्यवाद, धन्यवाद, कस्तो राम्रो काम।
कोई क्वेश्चंस आएंगे कम्युनिटी से तो आप पूछ सकते हैं।
तपाईँहरूकोबाट अगर केही क्वेसनहरू, केही क्वेरीहरू जान्नु छ भने के छ? त्यस्तो अहिले फिलहाल क्वेसन यस्तो केही छैन अरे। तपाईँहरूको यो करुणा फाउन्डेसनको जे छ त्यो चिज सिक्नु लागि उनीहरू लाइक वेबसाइटमा चेक गरेर उयो गर्नेछ भनेर भन्दैछ। तपाईँहरूसँग सम्पर्क मिन्स उयो गर्छु भनेर भन्दैछ।
हुन्छ, हामी त मेची खोलाको वरिपरिको मान्छे भयो। तपाईँहरू यता पशुपतिनगर आए पनि हुन्छ, काँक्राबिटा आए पनि हुन्छ, पशुपतिनगर आए पनि हुन्छ, नभए हामी पनि आउला त्यहाँ।
हुन्छ आउनुहोस्, मोस्ट वेलकम।
हस्।
अनि अर्को चाहिँ म के थप्छु भाइलाई भने चाहिँ, यदि तपाईँहरू, म पनि यो वुमन इम्पावरमेन्टमा धेरै वर्ष काम गरेको है, त्यसो तपाईँहरूलाई केही चाहिँ कन्सर्न छ, केही कुराहरू कन्फ्युजन छ भने चाहिँ सोध्न सक्नुहुन्छ मलाई पनि होइन। म चाहिँ नभए इमेल एड्रेस यहाँ पठाइदिन्छु, अनि तपाईँले कुरा नि गर्न सक्नुहुन्छ। अनि त्यस्तै जुन अहिले हामीले कुरा गऱ्यौँ नि, के अरे पार्टिसिपेटरी एप्रोचमा कसरी मान्छेहरूलाई मोबिलाइज गर्ने होइन, महिलालाई इम्पावर गर्ने भन्ने कुरामा पनि मैले तपाईँहरूलाई हेल्प गर्न सक्छु।
Okay, thank you so much.
Okay.
Although I really like this conversation. Maybe we can take parts of it also offline, because we also have quite a number of people who do not speak Nepali. Was it Nepali?
Yeah, it was in Nepali, yes, airline.
Yeah. I really like it. But I also like to honor some space and time for others in the conversation. If there are questions, please, this is your moment. Maybe there are some questions in the chats. Sid or Anna, do you spot them?
Yeah. I'm from Assam, Sonitpur, from Drissi, Pranav Hazare Drissi, and a Sovereign Committee committee members are from base area. I'd like Wang to translate in Hindi just sentences with Deepak sir has just converted. So had the conversation. So, I would like Wang, can you just explain it in Hindi with Deepak sir too, so that our participant can also participate on it.
जैसे कि दीपक सर के साथ मेरा जो कन्वर्सेशन हुआ है, तो हम लोग हिल्स में लाइक वुमेन एम्पावरमेंट के ऊपर में हम लोग काम कर रहे हैं। जो भी अभी लाइक हिली एरिया में लाइक वेदर कंडीशन टोटली क्लाउडी वगैरह होता है। हेलो,
I think can everybody other than who is speaking mute their mic? Banus bhai,
तो
Banus.
तो हम लोग जस्ट मीन्स वो बोल रहे थे कि इधर में क्लाउडी एरिया है, तो हम लोग कैसे हम लोग वुमेन को हम लोग कैसे एम्पावरमेंट कर रहा है। तो हम लोग ने अभी यहाँ पर इंस्टॉलेशन मशीन वगैरह इंस्टॉलेशन किया, डिहाइड्रेट मशीन वगैरह, जिससे आपका इलायची या अदरक उसको सुखा के लाइक पाउडर वगैरह बना के वो लोग सेल कर रहा है, तो वो लोग सोर्स ऑफ इनकम हो रहा है। तो उसके ऊपर में हम लोग बात किए। तो दीपक सर ने हम लोग को गाइडेंस किया कि अगर जैसे कि लाइक वो इंश्योरेंस वाला पार्ट, हेल्थ इंश्योरेंस वाला पार्ट जो चीज़ बता रहा है, तो वो वाला भी कर सकते हैं हम लोग। तो वही चीज़ बताया गया है।
नहीं, उसमें मैंने थोड़ा क्या बताया मेरा हिंदी उतना बढ़िया नहीं है, थोड़ा थोड़ा ट्राई करूंगा। मैंने उसमें क्या क्या बताया, इंश्योरेंस या इज बेसिकली ये सहकार्य का एक अवधारणा है, जहां पर हम सब लोग अपनी समस्या एक जगह पर रखते हैं और उसकी समाधान के लिए रिसोर्स कलेक्ट करते हैं। सभी लोगों की समस्या एक ही बार नहीं आती। जिसकी समस्या आती है उसमें हम सब लोग मिलकर संबोधन करते हैं। और इस जब हम हेल्थ इंश्योरेंस की बात करते हैं उसमें खुश इस बात से होते हैं, अगर हम इस साल हमने इंश्योरेंस में कंट्रीब्यूट तो किया मगर हम बीमार नहीं हुए। काफी लोग नेपाल में यहाँ पर जब इंश्योरेंस में ज्वाइन करते हैं और बीमार नहीं होते, कभी कभी वो दुखी होते हैं कि हमारा पैसा कहाँ गया, बेकार में हमने इतना पैसा लगाया था इंश्योरेंस में, वो मिसयूज हुआ। वो मिसयूज नहीं हुआ, वो आपके पड़ोसी या आपके समुदाय में रहने वाले दूसरे लोग जो हेल्थ अफोर्ड नहीं कर सकते थे, अगर वो उसका कुछ समस्या है तो वो वहां पर गया और अब आप और हम बीमार नहीं हुए, तो ये तो बहुत बढ़िया बात है। हम चाहते हैं कि हम हर साल थोड़ा कंट्रीब्यूट करें और बीमार भी नहीं हो ना हो। I think this is basically how the health insurance operates. इस स्वास्थ्य बीमा और कलेक्टिव वर्क इन कम्युनिटी ऐसे ही काम करती है मेरे विचार से।
There is another question. I don't know if it's answered because I couldn't follow, but there is another question from the chat. If the village-based health insurance approach that you've built, if it's built on savings-led village banking principles programming.
Well, I do not understand what exactly is that, but there can be many models based on the context. In case of India, so far I know, the local governments are not as strong as we have here in Nepal. ग्राम पंचायत हमारे म्यूनिसिपालिटी से ज्यादा अधिकार नहीं रखती है। यहाँ नेपाल में, here in Nepal, the municipalities, they have lots of autonomy, and they even can generate revenues in certain contexts. That gives them a lot of opportunities to bring the issues to the next level. So यहाँ पर हम जो भी करते थे नेपाल में, लेट्स मी ट्राई टू आंसर दिस आल्सो इन Hindi. I don't know whether it's from Hindi speaking guy or English, but maybe it's better to speak in English. What we did is, we bring people together. We explained about health insurance, and we started health insurance from the existing government health systems. In Nepal, there are 89 basic drugs that is provided free of cost to the population. So the scheme was developed on top of the free services of government of Nepal. So there was always advantages of collaborating and combining together. So this village banking program, or cooperatives, or in whatever form you are organized, and then pay the premium and negotiate with the health service provider, basically with the government providers, is they also are part of your own system and go to the next level.
But the current program, I guess, by managing by Karuna is not building on the saving-led village banking model. Mac, I think Mac is asking this question. Okay, so but we can easily build on that, because we are promoting saving-led banking approach in some of the area in this Great Himalayan Trail, where I think we are also thinking of how can we bring this health insurance scheme for the people. That's why I think he's asking this question. So we need to talk separately, Mac. So I will try to meet Deepakji sometime and then we'll discuss about it.
And I know that Nonso is on the call too. Nonso, do you also had some questions? I'm not sure if you have ability to speak up. Meanwhile, I will check the chat. He runs a health insurance program too. Ah, Nonso, go ahead.
Nonso, you are muted.
No, I don't think.
Yeah,
Very noisy place. Okay. I can't find your question that quickly. So anybody else still with some questions? We have a few minutes left. Time always flies.
I think a small question, Arline. Basically, whatever small experience which we and our team members in rural areas have, especially the way the remotest of villages are set, even in the average distance villages in India, mostly the issue comes in when there is a need of taking advantage of health insurance, but then the service is not available at the right time. So, or maybe in the nearby area. So, how do you deal with this situation of service partners, basically? Like
well, we are now not dealing with health insurance anymore, but I can tell you a little bit. The geography is always a challenge. And when you say about health insurance, it's basically the many insurance provider, they consider themselves as a provider. But in the meantime, if you ask people to pay, to contribute without having a best possible services within their vicinity, it's not working. So this is one of the complex phenomenon that Nepal also is facing, despite of having a national health insurance policy and good amount of money. So quality within vicinity has to be ensured before you start this kind of programs. But in the meantime, our philosophy is maybe we cannot solve everything once we start. We learn and we go to the next level, but we start with basic minimum. So we started with basic minimum. That was very rewarding. And referral was very big issue. Many times, even the people who the population wanted to get more diagnostic without having any need. They were asking doctors to prescribe for a video X-ray or all this blood testing. All these things are there, but you have to start and then you have to move. And then that's why what I believe is, there is no one standard health insurance program it's such to that fits globally. It has to be based on the context of each country. You have to try. There has to be trial and error for a couple of years, and then you have to develop your own policy. So that was one of my biggest learning of that process. And this is, I think, how I can respond to your concern, Sopnaji.
I think we recognize a lot of what you're saying. So let's, Nonso, would you like we have a few more minutes. So
yes,
go ahead.
I want to more practice. Hi everyone, my name is Nonso. I'm from Nigeria, and in Nigeria we provide access to insurance for families where they can finance insurance using cash or recyclables. And I've listened to a lot of the things you said, which are quite insightful. But I'm keen to learn. I know you don't offer insurance again, but I'm keen to learn what strategies you use to put these women together in the earlier time that you were trying to provide insurance. How you were able to build these communities together before you realized that the claim process around insurance was a big problem. Thank you.
Deepak, did you get the question? Or Betteke? But I think Deepak is better positioned.
But Erlyn, I didn't get completely what he was.
Could the others please mute if you're not speaking? Nonso was asking in the days that you was still offering the community insurance, how did the community engagement, how did you go and inform the community about health insurance?
So again, you know, again, we first of all we sat together with village leaders. By then, it used to be called Village Development Committee. And you know, we were lucky enough during that period because there was no election and there was all party mechanism in each villages. So almost all the leaders, major leaders of that villages were in the same platform. So we sat together with them, and once they were convinced, you know, that then they themselves went to the community. And it was so fascinating that, you know, when all the political leaders working together, approaching their population, explaining what exactly is, you know, is approaching to them, you know, that made us, you know, significantly progress. And as I said, we were able to enroll almost 80%. So, you know, that context is not valid anymore because we have election, there is an elected mayor. And yes, the mayor is very influential, very important, but there is also opposition. So in such scenario, my recommendation would be to approach municipalities, you know, is if to try to create consensus amongst political and other players, opinion leaders of that particular geography, and work together in the beginning and make sure that like your approach, what you have been doing time to time to these political leaders through your own reporting mechanism, but you know, as they are political leaders of that particular village, they also interact with people. You know, if the people say, "Hey, things are happening good," then the confidence goes to the next level. I think this is the fundament of our learning so far.
Mm. Thanks a lot. And like always, we always have too little time, but when we make the calls longer, we lose people halfway. So this seems to be the best timing. Sorry, because I have the feeling that we are sort of stopping in the middle of a very fruitful and nice conversation. But let me wrap up saying at least a lot of thanks to everybody, but especially to Deepak and Betteke for showing your model, even though it was very a little bit only we could see from all the years that you have moved the needle. Thanks a lot for sharing so openly. I'm pretty sure that you will follow up with some others that are interested and keen to learn more from it. So if you like the call and if you like the learning circles, make sure you subscribe to the newsletter so you know the next one when the next one is happening. If you have a nice topic, and I think Max suggested one that is interesting for the group of community-based change makers, and let us know if you have a interesting speaker. Let us know. We're very open. We make this space together. So thanks for bringing all your wisdom, your question, for sharing so openly, and hope to see you all in the next learning circle. And drop your ideas if you have good suggestions for topics and speakers. Thanks a lot, Deepak, for sharing. Thanks a lot, Betteke, for making it possible and sharing too, and all the others that have joined in making this call a very fruitful exchange.
Thank you, Arlene, for this opportunity and all the colleagues from around the world. I and Beteke, we know, there is no one solution of the issues that we are dealing in different contexts. So it's not antibiotics like, one tablet solve everything. So we have to develop our own model based on our own context. And I hope, what we explained is little bit, will help you to go to the next level. And we are very much interested to be in touch with you and learn from your interventions in your own context. Thank you.
Yes,
Thanks
and we
a lot.
all know that development starts and ends with the community. So it's very good to see all the community groups also participating in this learning circle. And thank you,
Yes, very
Arlene, for
nice.
organizing this.
Yeah, And you're always welcome to join and participate in the next one, of course. Okay, thank you all. See you next time.
Bye.
Thank you,
Bye.
ma'am.
Bye.
Bye.
Bye-bye.
Bye.